Hi, Scott Popp here from Popp Chiropractic and Rehab. We're going to talk about shoulder problems. One of the most common issues we see in my office are shoulder issues that have to do with activity, sedentary lifestyle, injuries. We're going to try to break it down and help you understand the different concepts and different mechanisms of shoulder injuries. We have shoulder impingement syndromes, we have strain sprains, we have rotator cuff tears, we have tendinitis and bursitis. And people get these terms all mixed up and confused, and what I want to try to do is help you understand the difference between all of them. So let me show you the joints and the mechanism of the shoulder first. The shoulder is made up of really two joints. The scapula, which is the wing bone here, is on the rib cage, and this bone has to move throughout space as we move our shoulder. And then we have the glenohumeral joint out here that has to orientate based on the spatial orientation of the scapula. So the glenohumeral joint and the scapulothoracic joints have to work in synergy to create good fluid movement of the shoulder. If something breaks down, we're going to have either a strain, a sprain, an impingement, or swelling of some sort, someplace, and this is what all these other terms mean. So what definitely happens, what are the prime movers of the shoulder? Well, just in shoulder abduction, which is going out like this, we have the upper trapezius going between the cervical spine and out here at the acromion. We have the deltoid muscle here, the deltoid, the middle, the anterior, the posterior muscle. We have the supraspinatus that goes through here. And then we have your serratus anterior that moves the scapula up and orientates the head of the humerus. All of these muscles are the prime movers of shoulder abduction, which is away. The oppositional muscles that oppose that movement are all of these inner scapula muscles, the rhomboid muscles, the levator scapula muscles. These muscles oppose this motion, and they bring the scapula into depression on the outside. So when you're pushing down like this, you're primarily using the muscles of the neck. Commonly we get strains someplace in this shoulder girdle that starts a mechanism of imbalance. There's one other group of muscles that are very important called the cuff muscles I forgot to mention. The cuff muscles are a group of muscles that form essentially a shield or a cuff to the humerus. Some of them rotate the humerus inward and some of them rotate the humerus outward. The orientation or the purpose of the rotator cuff is to hold the head of the humerus in its socket so that this orientation between the socket and the head of the humerus are always congruent as we AB abduct the shoulder outward or backward or wherever we want to go. Commonly we get small little tears in these fine-tuning muscles, and that's what's called a rotator cuff tear. Sometimes a rotator cuff tear is used for a tear to this supraspinatus muscle that goes through here, but commonly this starts with an impingement syndrome, and we'll get into that later. So we have all of these muscles that work in synergy, and you can have a strain. Strain is to a muscle or a tendon. We can have a sprain, if it's acute trauma, to the capsule or the ligament. We can have a tendinitis, meaning an inflammation of a tendon, such as the supraspinatus here, that happens with an impingement syndrome. Or we can have a bursa that's swollen, that when it pulls through this gap here, it can't retract properly, and it starts to swell and it starts to cause impingement. What causes all this mechanism? Many times the mechanism starts with poor postural alignment. Probably the most common issue we see as we sit at a desk is this head forward posture with our scapulas going out like this and our head into cervical extension that creates shortness of these muscles so that our shoulder can't abduct properly because the shortness prevents that scapula from going up properly. So the strain many times is here that has to be lengthened. We're going to talk about that. Sometimes the strain is out in the cuff system so that our external rotation or internal rotation is weak, and that can be tested. The shoulder impingement syndrome happens when these tight muscles cause a depression of this acromion and cause a pinching of the supraspinatus tendon right here. And sometimes we get a bursitis like we talked about there. So you can see the shoulder is a very complex and very synchronistic type type movement that has to occur, and it can occur from an injury from your neck all the way to your lower back. We even have our latissimus muscle that attaches to the lower back and attaches to the humerus here. So everything has to be looked at. Posture, strains, sprains, strengths in the rotator cuff, impingement out and through here, and usually shoulder problems do not happen in isolation. It's not just one issue. It's usually a complex issue. So it's not just one exercise that's going to get you better. In our next video, we're going to break each muscle down and show you how to rehabilitate not only your posture but your shoulder so that you can treat yourself. So thanks for watching this video part 1. Stay tuned for video part 2.